So happy to see so many faces today. My name is Callan Thornton, and I am with the Office of Behavioral Health. I'm the manager of gender responsive services there, and I have the pleasure of getting to work on the Tough as a Mother campaign and to get to work with our amazing panelists and Tough as a Mother ambassadors who are here today. Erin, if you will go ahead and share your screen. Going to just give everybody a little overview of what Tough as a Mother is. Perfect. So Tough as a Mother is a statewide public awareness campaign that acknowledges that addiction is tough, but we know that moms are way tougher. Tough as a Mother exists to decrease stigma around maternal substance use disorder and to connect pregnant and parenting moms to the support that they deserve. So today, I'm so excited to be able to introduce you to 4 Tough as a Mother ambassadors. All of the panelists on our call today are moms whose lives have been touched by addiction, and they are also professionals who have chosen to use their personal lived experience in a professional setting on behalf of those who may be struggling. So I'm going to give them an opportunity to introduce themselves in just a minute, but we have Megan Navarro with us from the Women's Recovery Center in Grand Junction. We have Glory McDaniel. Erin, if you'll go back to the panel with everybody's organizations, that would be great. I think I have most of them memorized, so I can keep going. So Glory McDaniel is with Chrysalida, and she is in the Colorado Springs area. Tracy Ritter is with the Denver Health Women's Care Clinic, which is part of Colorado's Integrated Care for Women and Babies program. And then we have Alicia Crowley, who is with Oxford House. If you want to take a look at the chat, Erin is popping in the links for all of those organizations that our panelists work with. And they're all pretty amazing. I encourage you to bookmark them, star them, save them, because they're wonderful resources in Colorado for pregnant and parenting moms who struggle with substance use. Okay, and then you can move to the next slide. So I want to do just a little bit of level setting before we jump into our panelist discussion. I'm going to be asking the panelists today to talk to us about stigma. And I've realized that stigma is one of those words that we all know, but I think it's helpful to have a shared working definition of what it is. So you can see it there on the screen that stigma refers to attitudes, beliefs, behaviors, and structures that interact at different levels of society. So this could be individuals, groups, organizations, larger systems, and that these attitudes, beliefs, and behaviors manifest in prejudicial attitudes about and discriminatory practices against people with behavioral health conditions, including maternal substance use disorder. There's one poignant definition of stigma that just kind of hits me in the stomach when I read it, that says, stigma is an attribute that is deeply discrediting and reduces someone from a whole and usual person to a tainted and discounted one, resulting in the perception of a spoiled identity. So there's 3 main types of stigma. The one that probably most of us are spot the easiest is social or public stigma, that's negative or discriminatory attitudes or beliefs that others have about people with a behavioral health condition. Structural or institutional stigma, that's systems level policies and practices that intentionally or unintentionally limit access and opportunities for people living with behavioral health conditions. So just one quick example of that one is like insurance coverage for behavioral health conditions, and does that mirror the type of insurance coverage that we have for traditional medical conditions? That would be an example of structural stigma. And then self or internalized stigma, that's negative attitudes and beliefs, including guilt, shame, and inadequacy that a person internalizes because of social stigma and structural stigma, but they internalize it about their behavioral health condition and their identity. So it's sort of this internalizing a belief about the type of person they are because of a behavioral health condition, and that is perpetrated against people by society. So now that we're all on the same page about stigma, let's do a quick chat about peer support. I realize that I'm really lucky in my professional career to have gotten to work alongside peers in a variety of settings. I used to work at the VA and worked with a young OEF, OIF veteran who was a peer in recovery from a substance use disorder and also had a PTSD diagnosis. And his role was to help talk with other veterans about getting into the VA and getting plugged into all sorts of services. So a peer is basically somebody who has lived experience either directly or as a family member or significant other, and who offers support because that peer role, they share common experiences or have faced similar challenges, and peers come alongside somebody who is currently struggling as an equal to give and receive help based on the knowledge that comes through that shared experience. So all of our panelists today, they may not today have the title of peer, but they are all working in some way, shape, or form in a peer support type of capacity where they generously use their personal lived experience on behalf of the folks that they work with. So let's move on to getting to hear from our panelists. So I would really like to start with having you guys introduce yourselves. So Megan, when you guys introduce yourselves, if you will just spend 2 to 3 minutes telling us a little bit about your journey and what brought you to the work that you are doing today. And we'll start with you, Megan.
Thank you all for letting me be a part of this amazing campaign. Callan, this is just such a blessing. So I am personally in recovery. I've been in recovery for 12 and a half years from meth addiction. And yeah, thank you very much, Tracy. I appreciate that. My journey was fast, hard, and furious. I grew up in Grand Junction, Colorado my whole life. And I was an all-around gymnast. I got hurt in gymnastics, and that really changed the path of my life. I started hanging around people that I felt like I got my worth from, and tried meth for the first time, and I just could not stop after that. Much like many other people's story, I had an addiction for 2 years. Fast forwarding, I ended up starting to distribute methamphetamines in Grand Junction and all across Colorado. I was apprehended in 2009 by the Meth Task Force here in Grand Junction, which, if you've watched my video, was what changed my life forever. I remember sitting in the back of a cop car and just realizing that this is not my life and I don't have to live like this. And I had no idea how to get help, but I just knew that somehow, some way, that's where my help was starting. I went to my court process, and I received 14 years in the Department of Human Corrections. And I just accepted it, and my family begged and pleaded to allow me to go to a rehabilitation center before I went to prison, which was granted. I went through treatment and found myself again. I found my voice. I found my power. I found my passion. I found that little girl again. I was just so amazing. And when I came back, the judge gave me a second chance, and she said, I don't know why I'm doing this, but I'm resentencing you to 5 years community corrections. So I got 5 years in a halfway house in Grand Junction, and I got to see my family every week. And there, my passion just took off. I started studying addiction and doing anything and everything I could to better my life. I've been in sustained recovery this whole time and just live my life to give back to others. So fast forwarding, I completed my sentence. I started my what then was called CAC, so Certified Addictions Counseling Certificate. I started at Mind Springs Health as a peer specialist in our detoxification unit, and I transported those around, that were still in active addiction that needed to get services and go to detox. I was there for a year and was promoted to an addictions counselor at Women's Recovery Center, where I had a caseload. I was a peer specialist and really just walked alongside those that were scared and didn't know how to get help, and walk them through a recovery center here in town. Then I was promoted to program coordinator of Women's Recovery Center, where I was able to manage and lead other peer specialists and credentials through doing the same thing that I was doing, which was giving back to those that were struggling with addiction and co-occurring disorders. Since then, we've launched a brand new program, which is our Circle program. I won't talk much about that since we're talking about Tough as a Mother today, but it's a residential program for men here in Grand Junction. And then I was the program coordinator for that program for a year. And 2 weeks ago, I was promoted to the director of Women's Recovery Center, the Circle program, as well as the detoxification unit. So I am living proof that you just keep following your dreams. You fight like a mother, and you stay tough as a mother, and you recover out loud, and you just get to keep moving up and keep spreading love and joy and helping those that don't have to be in addiction anymore. So thank you again, Callan. And I didn't know I was going to get choked up in this. Goodness.
Making me get choked up too and giving me goosebumps. Thank you, Megan. So happy you're here. Next, Glory, will you go ahead and introduce yourself?
Good morning, everybody, and thank you for this opportunity. So my name is Glory McDaniel. I am a licensed addiction counselor, licensed professional counselor, and working towards my marriage and family licenses as well. My story begins in New York City. So I'm Puerto Rican from New York City, and I was abused as a child, so beaten by my father and molested by my brother. And that started a cycle of alcoholism. So by the time I was 12 years old, I was an alcoholic. And I also tried many other substances as well. Fast forward, I lived in a very strict legalistic religious home where my father was the associate pastor. So I'm known as a PK, a pastor's kid. And so by the time I was 17 years old, I decided I needed to get the hell out of here. And I got married at 18 and then got into a domestic violence situation. So from bad to worse, I had to fight for my life and get out of that situation. I had to go into hiding for about 10 years, but I continued my substance. Went from alcohol to marijuana to cocaine. And then I became sober when I was 20 years old. So I've been sober for 27 years now. I did attend, thank you. I was in a rehab facility, but it was in Ecuador where I knew a missionary there that has to this day a rehab facility there. And I stayed there for 3 months in my recovery process. Then I unfortunately got involved with bad men. And so the abuse continued. My last abusive relationship was when I was 30. So the abuse continued, although the substance did not, right? So it's that, okay, chaos seeks chaos. That's all I know. I don't know anything else, right? And it's like as if we have a sign in our forehead that says, come abuse me. So I didn't learn the skills that I now have today, where I can set my boundaries, where I know what a healthy relationship is like. Had 3 kids, was a single mom with 3 kids, trying to raise them, trying to make ends meet, until I met my current husband, who helped me get to where I'm at today. So 2010, we moved to Colorado, and I started volunteering in a domestic violence shelter, fell in love with it. I mean, completely fell in love with it. So I decided to go to school. I'm an overachiever, even though I was always told not smart enough, not good enough, never accomplish anything, were the messages I heard when I was a kid. And so I graduated from Metro State cum laude, and then I went to work for COVA. So I was their case manager for human trafficking. Did that for a year, and then decided I want to see the story through. And so went back to school and got my clinical mental health counseling at Denver Seminary. So I have my master's degree. And so I have been working with victims of domestic violence and substance use for the last 7 years. Love what I do. I lead women's groups. It's a 12-week program called Mending the Soul, where women can address, this is the abuse I have had happen to me. This is why it led me to substance use. Identify how the abuse has affected their body, mind, and soul, and how do we heal from that? And it's amazing to see that trajectory. And so I love doing that. And I am the founder and executive director of Crisálida. It is soon to be a shelter for victims of domestic violence. We're currently working and providing women's group and individual counseling. And I am bilingual, so I get to do it in both Spanish and English. Thank you.
Thank you so much, Glory. What a powerful story. Powerful, overachieving, amazing, tough mother you are.
Thank you.
All right, next, we will hear from Tracy Ritter. Tracy, will you introduce yourself and tell us a little bit about your story and how you came to the work that you're doing today?
Sure. Thanks, Callan, for having me. And it's really great for me to hear all of your stories, Glory and Megan also. I love hearing from other people and their journeys through this. My journey began before 2018, but in 2018, I unfortunately lost my son, Evan, to a substance overdose. He was just 25 years of age. Evan did have, a history with substance use since about the time he was 15, starting with basically marijuana use and then progressing years into high school and then into college from there to more substances. We did get Evan as a family in and out of treatment facilities, which definitely worked for a while for him. But it's unfortunate that in October of 2018, it was very surprising to us because Evan, we felt as though he was moving forward with his life and living on his own, working and so forth, that he did, in fact, pass from a substance overdose. So it's been a tough time. And, throughout this, what I started doing about 6 months after that, I started speaking a little bit to other people that were at sobriety homes and things like that, where I would just go in and share my boy. I would share his story. And I would, do that with the purpose of trying to help other people that are going through addiction and trying to stay in sobriety and stay clean. And that's where I started. And then I actually got involved in some work groups with Tri-County Health Department first. And we started a craft group. So I became a craft facilitator, which is community reinforcement and family training. And I loved it. It was a great support for families and friends that are struggling with a loved one's addiction. So I was doing that. And then I also got involved with the Colorado Consortium, which I'm a co-chair for their Affected Family and Friends Work Group. And most recently, I've been at Denver Health as a peer recovery support specialist for about 8 months now, working here with pregnant women that are experiencing substance use during their pregnancy. And I've taken some coursework. I did go through a peer support specialist certification. And then I was well on my way to my CAC trainings online, but I have not finished that yet. I think that being a peer is really important. I think that, in my journey, I had hoped that not only my son, but others would receive that peer support and that connection with somebody to help kind of guide them and make a difference maybe in their own journey. I value that. I think that's very important. And I do know that Evan always used to say, you're really good at helping other people, Mom. So basically my purpose is to do the work that Evan would be doing if he were here today, because he always thought that if he came through his substance use and stayed clean, he could help others because he knew so much about it. So that's what I want to share right now. Thank you.
Thank you so much, Tracy. So good to have you here.
Thank you. Good to be here.
Miss Alicia, will you introduce yourself next?
Hey everyone, my name's Alicia Kroll. It's good to be here. I'm grateful that I get to be a mom in recovery today. My story began so I used drugs for the first time when I was 19 years old. Meth was my drug of choice, and it really just took a hold on me. I used for about 2 years. I've been to treatment 4 times for my meth addiction. And I had a period of 4 years clean once. And unfortunately, I wasn't clean off of everything. I did use alcohol and marijuana in between. And it was kind of a gateway drug for me to go back to my drug of choice eventually. I was lucky enough that I got pregnant when I was sober, and I had my son while I was sober. And it was the best 2 years of my life raising him. And then when I turned 26, I believe it was, I tried heroin for the first time with my husband. And that's really when things went downhill for me. That year I got in trouble. My husband went to prison. My son's father came down and picked him up and took me for custody, and I lost custody of him. And then 2 months later, my mom died. So my addiction kind of just really took a lot for me this last go around. And it took all of that for me to get honest with people and honest with myself about needing help. I didn't want to admit that I needed help. And when it came down to it, I really knew deep down inside that I did need help. So that's when I reached out to my probation officer and got honest with myself and with my family. And that's when things really started to turn around for me. My probation officer helped get me into treatment. And I went to the Women's Recovery Center. This was the second time I had been through that program. I did the whole 90 days. And when I got out, I went to an Oxford House. I've lived in Oxford House for over a year now. And I think that's what's made the biggest difference in my recovery, is being around other people that are like-minded. They all have the same goal. And now I have the opportunity to live in a women's and children's house. So I'm in a house full of moms, and we all support each other. And there's a couple moms that have their kids here. So we help support them. And I try to get as much resources as I can from the community to give the moms here, so that way they can start their recovery off strong. And I've worked for Oxford House now since May. So that has been a true blessing. Living in an Oxford House was it made a huge difference in my life. And I'm really excited that now I can give back to the community. And it's really cool because I sit on some of these consortiums, and I went to a regional governance board like last week, and I was sitting next to the sheriff. And it was just like a huge, I was like, wow, this, just thinking of where I was 2 years ago compared to where I'm at now, I never thought I would be here today. So I'm really grateful and blessed to be alive still. And that's all I got.
Thank you so much, Alicia, and thank you for being such an ambassador for Tough as a Mother. All right, well, we are going to get into some questions for our panelists. And, you know, all of you feel free to speak up and speak on the topics that you want to, and also no pressure to speak on every single topic. So the first thing I want to talk about is stigma, and I'm hoping that one or two of you would be able to share a personal example of the way that stigma negatively impacted you or somebody that you love on the road to recovery.
I'll go ahead and speak to that. As it's kind of like one of those sayings, what you've learned now, that basically I didn't know then. I've had to learn a lot now with Evan's, substance use and his addiction through the years. And I think that the thing that I hold really dear to me after he passed was he did a lot of journal writing, and he shared a lot of the social stigma that faced his life throughout his high school years and into his adult years too. And I think that stigma is a combination of so many things that Callan touched on earlier: structural, social, and self stigma. And I can see that from a perspective of somebody that's struggling with substance use, because they may not get those opportunities because of the way they're viewed as, I hate this word, addict. I really dislike that word. I think it's better to use a person with substance use, even substance use disorder if you want. But I think that they're shunned upon within the medical corporation many times. And then I think that, like in Evan's case, I think he felt that. And I think that sometimes he was a very charismatic young man, very outgoing. But I think because of his addiction and because of doors that weren't open for him, he felt stigmatized, although he didn't want to share that with us. I think personally he felt that more because he was confident, he was proud. And but I think through his letter writing, I see that now. So because he gave me that gift, I want to let others know that, we shouldn't do that. We need to change the way we treat people in the way of stigma, because it does affect social stigma and personal stigma or self-stigma also. And it did for him.
Thank you, Tracy.
I think for me, my first thoughts and feelings about stigma were when I hid my addiction. My family did not know of my addiction for quite some time. And when they found out, rather than asking me what I needed or how I was doing or what they could do to help or, what had happened, I was met with, I can't believe you're doing this. You grew up in a great family. Our family doesn't do this kind of thing. Who your mother is in this community, those types of things. And like, I even heard the word, what you're doing is disgusting. And so I internalized family and social stigma, and I bought into it. And my negative core beliefs then were, you're disgusting, you're never going to be anything, you're never going to be like our family anymore. And so I think those negative core beliefs is what drove me to, well, if this is what everyone thinks of me, then I really pushed it to the next level of instead of using substances, I began dealing substances, and that became my life. And so very much like what Tracy said, I my negative core beliefs grabbed hold of stigma rather than, running with my arms open. I pushed everybody away that had an opinion about it.
I want to include the Hispanic Latino population, right? Where what's mental health? What's substance use disorder? They don't believe it. They don't think it exists, right? And so what I enjoy doing now is educating the Hispanic Latino population on anxiety, depression, trauma, all these things that lead to substance use, right? Religion, right? My father was a pastor. I was shamed, right? Although nobody knew anything until I was 19 of what was going on. I started drinking when I was 12 years old. In my house, no one had a clue, right? And then when they did find out, it's like, oh my God, your dad is a pastor. What are you doing? Right? So no support whatsoever, just disgrace.
Can you guys speak to, so an experience that you had, Megan, I heard you say, when you talked to your family about the fact that you were struggling, that nobody said, what do you need? And I'm curious on each of your perspectives with that, of either while you were struggling or even, during your various recovery journeys, what did you need when you were struggling? What would have been the opposite of stigma? And do you have any examples of, I guess, first naming what you needed, and then any examples of something that profoundly impacted you to help meet that need?
I can answer that. So something that really helped me was just when I got honest with my probation officer, I told him that I have been using and I have a problem. I can't get clean on my own. He actually was like, this is great. We can actually work with this. And he gave me a little bit of praise and a little bit of encouragement that made me feel like I was actually doing the right thing by getting honest and telling the truth and admitting that I had a problem. And I think just support was really all I needed. It's really important that people acknowledge like your pain and that you're actually going through something that is causing a problem in your life. And when you reach out and people just shame you for it, it doesn't get you anywhere. Really just getting support was really all that I needed. And I was really lucky that I got that from my probation officer, because that's also another like stigma, is that like I assumed that my probation officer was going to throw me in jail for something like this. So that's what kept me in my addiction and kept me from being honest for so long.
I appreciate you. That's such a great example of weaving stigma into this conversation, of just that, you had that assumption for a reason, because society oftentimes has a punitive reaction when somebody says, I'm struggling with addiction, versus like, oh my gosh, I'm struggling with diabetes. The two reactions are oftentimes very different. And so that you picked up on and internalized, like, this is something I'm going to be punished for. The fact that you were able to overcome that and make the choice to reach out for help in the face of all of that is amazing.
I think mine is much like what Alicia said. I think I just needed support rather than judgment. And, I truly believe that the opposite of addiction is not sobriety. I think it's healthy connections, and then that, supports you in sobriety. And what I received was shame and judgment. And it wasn't until the judge that was on my case, I had family all around me, and she asked me, what do you need? Like, what do you need from us? And through all of my, my entire court case, that's the first person that said, what do you need? Rather, people were saying, you're not welcome here for Christmas. You're not welcome here because your sisters can't see you this skinny, or, I was met with disconnection. And so when a judge said, somebody that you perceive as being against you said, dang, Megan, what do you need from us? And that was the very second that I felt hope back in my heart, where, oh my gosh, somebody of this magnitude and empowerment cares to ask me, like, regardless of who's behind me, I'm going to be okay.
I'm so struck by that question of, what do you need? And it reminds me, in part of trauma responsive care, that oftentimes when somebody is experiencing trauma, the world sees behaviors and we say things like, what's wrong with you? Instead of saying things like, what happened to you and what do you need? So I just love you lifting up and highlighting the importance of, support, not judgment, and not what's wrong with you or what are you doing, but what do you need and how can I help? Thanks, Megan.
And I think that I really like how you put that with the healthy connections. And even in the work that I do as a peer support, many of the women that I see, they don't feel supported, whether it be at home or have had a traumatic situation oftentimes in their life. And it's just been a history of family that's experiencing substance use, their family. It's kind of like all they've known. And I think that many times I see that these women don't come in for their prenatal care, or they're in and out and not consistent because they feel shamed. And not only that, they also feel as though they're being judged, and that automatically CPS, Child Protective Services, is immediately going to get involved if they are aware that they're using any type of substance. So I think it's somewhat trying to inform and guide these women that we can refer you to the Women and Family Services at Denver Health, and they want to support you through this process, just as I want to support them and their provider wants to support them, so that we can get them into treatment. But I think there is very often that misconception that, I'm in trouble. I can't go there. I can't do that because my baby's going to be taken away. So I see a lot of that.
I want to say for the Hispanic and Latino population, right, where everything stays within the family, we don't talk about things. We don't bring anything to light, so to speak, right? And so that shame of, how dare you go to somebody else? How dare you go to a counselor? How dare you go find help when we're supposed to be able to take care of one another? But instead of helping, all we do is put them down, right? So how do we set a boundary and protect ourselves and actually go seek the help we need, right? Regardless of what our family says, right? We have to do this for us and for our kiddos and for our biological families.
I want to go back to what you were saying just a minute ago, Tracy, about, you were mentioning kind of the work that you're doing as a peer and what that looks like at Denver Health. And I don't know among our audience members today how many folks have had the opportunity to experience peer support, or maybe in a professional context, like work alongside a peer support specialist. But I would love to hear in all of your own words, why is peer support so powerful? What about it is powerful?
Well, first of all, I'm still learning about the role because this is relatively new, and it's a new pilot program here at the Women's Care Clinic. But I think that I look at it as a very, it's non-judgmental, so that, I'm I'm there for somebody, not from a clinical perspective, but from somebody with a lived experience that can relate in some capacity to what this individual is going through. And I think that that takes some of the barriers down and away from some of these women. And I think like anything, it's relationship building. So it doesn't happen overnight, because oftentimes I'll be very surprised and somebody isn't wanting that help or that support or that guidance right then, but maybe a month into it, a month later they do, and they're ready to go into treatment, or they're ready to go and start, on methadone assisted treatment or some other way, some other form of treatment. And I think there's a readiness to it. Like anything, you have to be ready. And some patients and women aren't ready at that moment, but I think that they'll get there oftentimes. And with them just knowing that I'm here and they can call me or text me or come into the clinic, I think that provides more support for them than not. And they've said that too. So I feel like that's been a good benefit for this program here at the Women's Care Clinic.
I love that you brought up readiness, Tracy, and kind of what I heard you say is that, somebody is still deserving, bring it back to Megan's point, somebody is still deserving of connection and support, whether they're ready or not for treatment, and that maintaining that relationship and those messages of support is so powerful in keeping the door open for whenever a moment or a time of readiness happens in the future.
And I think peers show us that one, we're not alone. We're not alone in this. And two, that if somebody else has been through even an ounce of what I've been through and they are where they're at now, holy heck, I can too. So I think it's just that empowerment. And again, I keep saying it, but connection is so important. And just knowing, if there was a peer before me that I watched, studied, and their every move and how amazing it is. They can climb ladders that most people don't think that you can climb, and they do. And it's just giving back as well.
I'll second that, Megan, right? Because although I'm a professional counselor, when I'm facilitating my groups, I get to share my story, right? They get to hear where I've been, what my process was, where I am now, right? And how powerful is that, right? Where they're like, oh my gosh, I can do that as well. I'm not the only one in this situation, right? She's been through it. She understands exactly what I went through. Although our stories are not the same, they are similar, and we can support one another. And what I love about my groups is by the end of the group, they have their own support system within the group that is going to continue to help them and lift them up.
Glory, can I ask you a follow-up question? Because I think your comment earlier was poignant when you're sort of talking about cultural norms within the Hispanic Latinx community about, we take care of our own. How do you see peer support being powerful in that context in terms of, you talked about education and kind of changing cultural norms around talking about trauma, substance use disorder, anxiety, depression?
So Tracy mentioned before the craft groups, right? I've done them in Spanish, and how powerful is that we get to educate people about substance use disorder, about mental illness, about, what it looks like, right? And how we can help our family members. So it's education, it's prevention, right? It's saying, it doesn't have to be this way. There are people outside that want to help. Let's seek the help we need. Just like if I was having cholesterol problems, I would take a medication for my cholesterol, for my diabetes, for my heart concern, right? There's assistance that we can seek out. There's no shame in asking for help. And it's minimizing that shame aspect.
Do you think that, you identified yourself earlier as a Puerto Rican woman? Do you think it makes a difference in the Hispanic or Latinx community for you to share, I'm Puerto Rican, I speak Spanish? Does that make a difference in any way in terms of the type of peer support or stigma that you're able to influence or dismantle?
A huge difference, right? I speak their language, right? I know what the culture is, right? Because although I'm Puerto Rican, Mexican, Guatemala, Honduras, we're similar in cultures, right? And that connection of our family is knit, right? We stick together through thick and thin, unless, right, there is addiction, then we'll just like excommunicate them, unfortunately, right? But being Hispanic, being able to speak the language, there's a greater connection, I feel.
And I just want to say, Gloria, I think that's great what you said about craft and about the families. Addiction is a family disease, and oftentimes we don't realize that enough. And again, I think at the time that we were going through this as a family, I feel like there wasn't enough support out there. Early in the 2000s, it was really hard to find that support from groups and other family members where we could, feel as though people understand and relate to us, and to be able to be provided resources and help, community services and help at that time. Because, as a family member, when you're in that moment and your loved one says, I'm ready to go into treatment, you are doing everything you can in that given moment to find them a place to go. And, we don't always have places for our loved ones to go, because there may not be beds available. We may not be able to afford it. And, as a family, we did what we could, and we just paid out of pocket. And we got through, but it's very hard. And honestly, I think there needs to be a lot of support, even more support around families, and families talking with their loved ones, so that it's all together. We talk about this disease. We come together, because I think that's where improvements are going to take place, when we're open and honest and not judging, and we're loving. And I think that that's where you're going to get the best outcomes ultimately from somebody that is experiencing substance use.
Thanks for that, Tracy. And I'm glad that you mentioned the substance use disorder being a family disease. And I do think so often in the old model, there's the identified patient, and we forget, especially in the context, one of the pillars of gender responsive services when we're talking about pregnant and parenting women and mothers is just the absolute importance of relationships in many women's lives, and how it's not, treating somebody as an island, but looking at somebody in the context, back to Megan's point, of their need for positive, healthy connection and relationship. So we have just about 4 minutes left. I can't believe how fast this all went by. So one thing I would love if each of you would answer. I want to end today on just hearing, what does recovering out loud mean to you, and why do you feel strongly about recovering loudly?
I'll start. I feel like recovering out loud helps combat stigma first and foremost. but I also believe that when I personally recover out loud, I am providing a space for others that are vulnerable, scared, fearful, still have negative core beliefs that tackle them every day. I'm providing that space for them to be able to empower themselves to enter recovery and start, being tough as a mother and start recovering out loud for themselves. I think that recovering out loud for me is another shield against stigma, against my own insecurities that as human beings they pop up. And so I forever will stand on rooftops and mountains and panelists like this and just tell my recovery story so that it's possible for others to continue to do so. I think recovering out loud shows others that they're not alone and that peers are powerful. They empower others, and that recovery is so amazing. It gives us a blessing to be mothers, to be wives, to be husbands, to be healthy and happy and free from addiction.
And I think I would say about recovering, and with the success that I've seen from women here in the clinic, who are doing that and changing their lives right now, it's such a gift to share that. And I want to see more of these women share their recovery stories with other women, as we're talking about in a small group setting where we're empowering everybody and empowering others that are on that journey, because recovery is a lifelong journey, and you're just not over it. You have to keep working toward it and working at it. And I can learn a lot by hearing other people that have gone through that or that are going through that. And I guess when you mentioned recovering and recovering out loud, I think of grief, and I think of a family's recovery from grief. And that too is a lifelong process that shapes us as we go through life and changes almost daily with how we're feeling in that day and on that given moment, and how we're managing to work toward other things in our life. We never get over the loss of somebody. We just have a new way of living through that loss.
Thank you,
I think
Tracy. Gave
that,
me goosebumps.
Oops, sorry.
No, go ahead, Alicia.
I was just going to say, I think that recovering out loud gives people hope. Being transparent with your own recovery can help somebody else who's still in active addiction see that they can do it too.
All the above, and building a support system for when I feel I need help. I reach out to my support people and say, hey, I need help right now. There's no shame in asking for help.
Thank you so much. Gosh, you have all given me goosebumps and just continue to compel and inspire me in this work. I just want to say such a heartfelt thank you to our panelists today. You guys are powerful, you're strong, you're inspiring, and so courageous. And I just thank each of you so much for the generosity, gifting us all with your stories. For our audience members, there's a bunch of different links and resources in the chat, and feel free to follow up with me if you have any additional questions or want to learn more about the Tough as a Mother campaign and recovering out loud. Thank you so much, and everybody have a great rest of the day.
Thank you, Callan, and thank you. It's nice to meet you all.
You too. Keep doing the work you're doing, ladies. Bye, Callan.
Thank you.